Hello, everybody. My name is Mike Dowling. I am the president and the CEO of Northwell Health, and I would like to begin by welcoming you all to this 5th Constellation Forum. I thank you for participating and look forward to having a very interesting, informative, and enjoyable few hours. I also want to take this time to say a special thanks to all of the speakers and all of the moderators. And of course, I also want to say a special thanks to all of the staff that has made this possible. It's an opportunity today to network and to share, to learn from one another, enhance relationships, and of course, talk about those things that we need to be seriously thinking about as we move forward. You know, I'm sure all of you would agree with me that this is a special moment in time. All of us who are involved in healthcare, and for that matter, everybody that is involved in any industries, we're all impacted by certain issues, some good, some not so good. We're impacted by cost pressures, inflation, supply chain disruption, the evolving nature of work, the advances and the dramatic advances in the utilization of technology, the dramatic advances in science and new discovery. And of course, we're all dramatically changed, both personally and organizationally, by the experience of COVID. And we have to learn from the lessons of COVID. And of course, we're all impacted by the tumultuous political environment globally, and you could argue that we have a similar tumultuous environment nationally and in many countries. All of this affects us. But as we all know, it's not what happens to you in life, it's how you respond to it. So this is not a time for retreat, and this is not a time to focus on being pessimistic and think only about the bad things. This is a time for leadership. It's in many ways, in my view, a test of leadership. This is a time for innovation and creativity. This is a time for us to think and rethink anew, to figure out how, in the environment that we're in now, how do we make an increasingly positive difference? How do we challenge the status quo? How do we not just look back, but how we look forward? Somebody once said, you know, that nostalgia is not a strategy. We, especially all of you who are participating today, are leaders in your field, and we have to be thinking about the world that we would like to create 5 years from now. If we project out and we were sitting here 10 years from now and look back, what would we say about what we have done? And you know, all of us, we're very, very fortunate to be involved in healthcare. This is a wonderful profession to be in, because each and every day we get an opportunity to change people's lives, to enhance the lives of people in our communities, to improve the community overall. We get a chance to perform miracles in our facilities, our hospitals each and every day. And now with the tools of technology and a lot of the other assets that we have at our disposal that we didn't have years and years ago, the opportunities are extraordinary. We have a special obligation and a special responsibility. And I believe that we, collectively working together, will dramatically improve healthcare. We will improve access. We will improve quality. And of course, as you would all agree with me, we have to. But we have to make sure that as we continue to improve and enhance and get better, that we make the benefits of all of that improvement accessible to everybody, not just for some, for everybody. And one of the lessons, of course, from COVID was the inequitable distribution of services and inequitable access to optimum services. Those things we need to fix, but I know we can. We're in a great place. We have developed over the last number of years, among many of us who are participating today, enhanced relationships and knowledge of each other and what we each do. And you know, one of my favorite quotes is by David Thoreau, who said that it's not what you look at that matters, it's what you see. So we should ask ourselves, what are we looking at? But what do we see? Do we see a better future? I would say yes. I see a better future. And we have to be optimistic about that better future. I see, as I look forward, that we have a constellation of opportunities, a constellation of avenues to do things in an improved way, to do things better, so that the community is better off, people who need our services are better off. I see us redefining what we mean by health, broadening the definition of health. We all come from different parts of healthcare, different disciplines. But as we all work together, we are not going to be constrained by the problems. We're going to be enhanced and inspired by the opportunities. So again, I want to welcome you all. I want to thank you for being with us again, for those of you that are attending and have attended the other ones previous. And we look forward to continuing to do this each year, build our relationships so that we can build a better future. Again, thank you all so much. Appreciate you attending. I hope you enjoy the next couple of hours. Thank you.